what I want to do in this talk this morning is to just give a very brief outline of the research that we've done. I know for the vast majority of you, you're familiar with this, but we have quite a number of new participants. So I just wanted to quickly recap on that. I want to then talk about the indications we're getting about the general acceptance that there is a need for change, and what then might happen at a national level if that change happens. And really what we're trying to focus on in this talk is what then can we, all of us, do to promote change at the local level, at the local council level. And I'm going to share our ideas with you. And then we have discussion where you can demolish those ideas or suggest new ideas and so on. So I've got everything that I say is underpinned by the statement, which appears simpler than it is, that we're talking about families who approach local authorities, who come into contact with local authorities, and for whom there is no evidence, objective, cogent evidence, that there is neglect or abuse for their child. That's the group of people we're talking about. We're not wanting to stray into the territory of child protection issues where the local authority has cogent evidence of neglect or abuse. We're not saying that that's all hunky-dory. It's just that we're trying to keep this issue at the moment separate from that other issue. We published a major report on this in July last year. That's accessible on the internet. It's been downloaded tens of thousands of times and cited hugely. And the conclusions of that, well, as Derek's just said, the Cerebra Project information line, advice line, and other projects have been receiving a lot of distressing calls from families with disabled children. Families who approached their council for support and found themselves directed to safeguarding teams and treated as if they were neglectful or inadequate parents. And many of them videoed experiences of having assessors visit their home without notice, sometimes often at short notice, insisting on seeing the child's bedroom and interviewing their children alone. And although the parents had contacted the local authority for help, they were instead sent on parenting courses, or at best given early help services. And this left them distraught and humiliated, and in many cases, determined never to make contact with the local authority again. So the way we work is that Cerebra, through its advice and information line, identify commonly occurring problems. And then at the research centre at Leeds, we try and analyse, what's going on and what can be done about it. And we looked at all English children's services protocols we could find. There are 152 potentially, but we could only find 143. 80% of these required that assessors confirm the child's bedroom had been seen. This is regardless of whether it's a child protection or a disabled children's assessment. 80% required that without distinguishing. 87% said the children had to be seen alone or communicated with alone. None gave guidance to assessors concerning the need for cogent grounds to exist before seeking to see a child's bedroom or seeking to interview a child in the absence of the parents. And many parents said, the social worker said, look, I need to see the bedroom. And of course, in a way, that's an impossible question, because if the parent says, well, I don't think that's appropriate, then they immediately think that there's something to hide, that they're going to be criticized. And that was said time and time again by parents, that they felt that it was an impossible situation. And none of the protocols that we looked at contain guidance concerning the need for separate assessment process for disabled children, that disabled children and their families should be treated differently to children suspected of neglect or abuse. And what was interesting was how similar all these protocols are. They are largely, 87% of them are drafted by one private company, and they all look the same, although the idea is that local protocols should be the subject of local discussion and they should all be rolled out differently. They are actually standardized documents. And the vast majority had a page like this. And if you looked at that page, they all said that the line manager must review assessments regularly and ensure actions like the following have been taken. There's been direct communication with the child alone, that the child's household has been seen, that the child's bedroom has been seen. And so the key finding was that there's a really serious problem here, because we're lawyers, and as lawyers, that is just not acceptable to have policies of that kind. Policies that adopt a default position assessing disabled children, that their parents are at fault, that locates the problem of a child's impairment within the family rather than wider society. And that's why we call it institutionalizing parent-carer blame. And a lot of the blame for this can rest at the door of working together, the National Department for Education guidance. And there is, in our opinion, no doubt that these policies are unlawful, and local authorities are wide open to being sued, as is the Department for Education, for breaching the Human Rights Act, the right to private and family life, and the right not to be discriminated against. And there has been preparatory litigation on this, although it looks like in both cases, the relevant parties have agreed to change practice and settle. But I think unless something is done at a wider level, there's going to be more litigation, and we're not encouraging litigation. The big problem is that working together fails to address the distinct assessment needs of disabled children who aren't, for whom there is no evidence of neglect or abuse. And there's no requirement that assessors have impairment-specific expertise in relation to disabled children. They may well just be experts in child protection. Now, what's happened during the research and since is that basically at a national level, there is an open door. There's an acceptance that this is a problem. It's a problem that's not a recent one. It's been inherited by the Department for the Education and the experts there. And pretty well everybody that looks at this says, yeah, it's wrong, it's got to change. So we've seen that the chief social worker for children at the Department for Education, the Department for Health, has stated that this is a long-standing problem, that there is a tendency to use social work assessments as an opportunity to judge parenting capacity through a child protection lens, just for parents of autism who contact seeking help. So she has put her name to a document that says, yes, this is the problem. The McAllister review that is yet to report, but hopefully fairly soon, accepts this too, that a consistent theme of his review is that the families with disabled children felt that they're navigating a system set up for child protection, not support. And most recently, this is echoed in the SEND review, just published, saying much the same thing, that families with disabled children tell us they're often, they seek support from children's and social care. They're put off seeking support from children's social care because they fear they will be blamed for challenges their children face and treated as safeguarding concerns. So there's a general acceptance, I think, at a national level, this has got to change. It's just a problem that has developed. There's no particular blame in terms of individuals. It's something that's happened that's got to be changed. So what's likely to happen at national level? This is a sort of crystal ball gazing exercise, and I'm normally wrong on most things, so I could get this wrong, but this is what my perception is. The one thing we do know is that the National Autism Strategy is it has been changed, and in April there will, in May this year, there will be a requirement for assessors of disabled children to have autism awareness and expertise. And I think that it's almost inconceivable that that won't be widened to assessors of disabled children having disability-wide expertise. It would be highly discriminatory to limit it just to having expertise on one particular condition. So that much we know will be happening, and that will be quite a significant change for many authorities who have very few assessors with that sort of expertise. They'll have to take action on that. I think that there's a good likelihood that working together, which is the guidance document that we think is a significant cause of the problem, will be amended. It can easily be amended. It's normally amended once or twice a year. And it will be amended to require authorities to have distinct pathways for disabled children where there is no evidence of neglect or abuse. And in the medium term, I think the Department for Education will have to issue specific guidance on the assessment of disabled children, distinct from safeguarding issues. There was good guidance in 2000, which was sort of almost recklessly annulled, and in the short term, it's quite possible that that could just be reissued. It would, in very many respects, be fit for purpose. So that's national level. It looks like we have got agreement on acceptance of change. I think the only issue is how quickly that will happen. I don't see any reason why it shouldn't happen fairly quickly. The Department for Education has already been alerted to the fact that it may be joined in litigation. I don't see any reason why it shouldn't take fairly prompt action. There's nothing in it for it not to do that. So what about local action? And the first question I really ask is, why should a local authority, and we've got a number of colleagues from local authorities on this call, do anything? Why don't they just wait? They've got a huge number of problems at present, so why grasp this particular nettle? Well, I think there's a lot of reasons why committed local authorities shouldn't just wait. Most importantly, this is causing huge harm to families. It's a highly problematical process, and I think it's causing huge trauma also to frontline staff that have to operate this. But families are suffering harm, and that is something that children's services shouldn't be inflicted. It violates fundamental human rights, people's right to respect for their private and family lives, and the rights of people not to be discriminated against. Local authorities are going to have to do something because of the revised autism strategy that's going to come in this year anyway, and this could be just part of that process. And working together does actually require them to have assessment policies for particular groups, including disabled children. And our research shows that they don't. That basically, they have 2 or 3 paragraphs in their local protocols, but the process is pretty well identical, except for perhaps children that are so severely impaired that they might actually be assessed by a separate disabled children's team. And that really opens them up to litigation. And in a way, litigation doesn't really in itself solve anything, but because normally it's settled and local authorities agree to resolve their particular issues. But if we want 152 local authorities to change their policies, we've got to have buy-in from those local authorities, and not simply because they want to avoid litigation. Largely, one would hope it is because they don't want to continue inflicting the harm that we've identified. So what can be done? Well, what we're focusing on, what I think is really crucial, is for there to be a direct sort of conversation, discussion between local authorities, particularly those with strategic leads that get it, effectively, that are proactive, that do see this as an issue, and independent parent carer groups. That's got to be a local discussion, and I think that's going to be by far the most fruitful way forward. Anna and I and the research team at Cerebra are very happy to do everything we can to facilitate those conversations, but that's, I think, where it's got to happen, at the coalface. And it's not going to be good enough for local authorities just to change policies, because that's pretty easy. It's the practices that we're interested in, the really fine-grained stuff. And of course, part of that could be co-producing training programs on the new procedures and their principles. And having parent carer support groups would be essential in that. And there are also quite a lot of quick and simple things that need changing. And there's also going to be a need for more strategic action. So we've done a list of quick wins. I'll show you in very close consultation with parent carer groups. It's something that's been led by parent carer groups about simple things that could be done. Just for the first point of contact to be kind, accessible, welcoming, listening, empathetic, to say it must be incredibly challenging to have a child with these impairments in today's society. It must cause huge problems just to identify and be empathetic, to stop referring disabled children through the multi-agency safeguarding hubs, but to have you could have a single line, but to stop using that safeguarding word and to do something more tangible. To develop, because I think it's going to be essential, an assessment process that's quite distinct and doesn't use assessments, as the Chief Inspector has said, as an opportunity to judge parenting capacity through a child protection lens, to focus on family support, not parental failings. And it's work we're doing at the moment, but to have one website that isn't a complete mess, as most of these local offer websites are, that is accessible, is jargon-free, and is quite clear about a range of supports that is available, including parent care and needs assessments, not always talking about early help or short breaks, which seems to be, the only two go-to offers. And so we've in very much conjunction with parent care groups, done a Doing It Differently document, which has a lot of these fairly simple issues that could be done without upending the universe. There are some bigger ones, and one of the ones that I want to focus on in this talk is the issue of assessment forms, which is really what we're beginning to be very interested in. And in the discussion, I'd hope that you can tell me if that's a good idea or a bad idea. So I've also already mentioned sort of co-producing awareness training, but in our discussions with change organizations, particularly within the NHS, some interesting ones going on, what we're being told about is that awareness training is very useful, having parents talk about their experiences of dealing with the system, but its impact can be short-lived. And I've said this before at another webinar, and I'm just going to repeat it because it's something that has chimed very strongly for me, is that if you want to bring about meaningful long-term changes to the way frontline staff treat disabled children and their families, yes, training is useful, but it's only one strand. And the really fundamental issue, curiously, is changing the forms that they use. And in so doing, rewriting the computer program. And so this is really what Anna and I are particularly interested in at the moment, and we'd really like your views on. Strategically, the forms, these assessment templates that assessors use, are crucial in our view, because assessors use these forms day in, day out. And the questions that these forms ask, the comments that they require being made day in, day out, remind the assessors what their authority's values are. And so if these questions are all about child protection and avoiding a baby P case, that's sending a clear message to the assessor and the assessed that that's the issue, we're into child protection. But if you change the way these forms are drafted, talking about disabled children, they can communicate very strongly to assessors and families that the authority has different values, that it's concerned about the well-being of disabled children and their families, that it's empathetic, that it wants to understand and learn from experiences and so on. So these forms are really like a daily ritual, a daily routine that all assessors use all the time, and they expose families to it. And it's this sort of credo, effectively, that goes into the hearts and souls of families and assessors. When you start looking at changing these templates, you realize it's actually not that simple in general, because assessment forms are used for a whole series of other tasks, not just gaining information about the family. They are used to inform eligibility decisions, to record what's been done, not because you want a record of it, but you want in a way to cover your back. It's a sort of way of saying, well, we did look at this. It's a way of capturing a lot of the endless amount of data that the Department for Education requires in its annual returns. It's a way of demonstrating you've hit arbitrary performance indicators. It's, we've done X number of theses, and for paying for Ofsted inspections, we have come across local authority data that shows that they were keen to show that all children's bedrooms have been inspected, regardless of reason, because they had a pending Ofsted inspection. So these forms are capturing data for all sorts of difficult and sometimes highly suspect reasons. And there's a rich literature on forms. Obviously, it's interesting to Anna and me because we're sort of in the academic field, but I'm just going to quickly mention some of them. Really interesting. What happened is that these forms, this computerization of social work happened big time under the Blair-Brown government, and largely as a response to the death of Victoria Climbié. And we had a thing called Integrated Children's Systems, ICS, introduced that in a way local authorities remain with. And as Sue White and her co-authors say, this is the forms we're working with today as well, effectively the relic. They are based on a national specification comprising workflow modes, which rigidly adhere to a business process in terms of branching sequences of tasks and timescales. There's a set of electronic forms called exemplars, and there are software suppliers that then produce these forms and software compliant systems that go with it. So this isn't something a local authority can just decide it's going to change the form, because this is all integrally tied into these dreadful, in my opinion, bureaucratic labyrinths, basically. And White, she is highly critical of ICS. A lot of people have been. And as all of you will be familiar with those criticisms, that it consumes a huge amount of time, social work time, it's unsafe. The overall effect of such processes is intensified bureaucracy that reduces social work assessment tasks to a data entry process, curtailing time for visiting and thinking about casework. And we all know this has happened. And I'll move on this, but she's got some lovely discussions with frontline social workers to saying, why are you doing that? And they say, because I've got to do it. It's absolutely pointless, but I've got to do it. And you'll get this PowerPoint. We'll be posting this so you can read this stuff. And one of the most insightful critiques of the child protection system was a review done by Professor Eileen Munro just over 10 years ago. And she really laid this out full square, that it was form filling that was destroying the system, not safeguarding children. Now, all of these critiques are about the child protection system, but unfortunately that system has sort of enveloped a different system, which should be different, which is protecting disabled children from the problems that they experience because they're disabled, not because they are at risk of abuse and neglect from their families. So what we want to do in this piece of research that I'm now just going to sort of quickly recap on is, in a way, to jump the gun. We've got effectively a golden opportunity, because we're not talking about amending forms or systems. We're talking about creating a new system, because there isn't a system for the assessment of disabled children that really truly separate system that's got to be developed. And so we can sort of, in a way, go back to basic principles and say, what would these assessment processes look like for disabled children? And we don't need to worry about having to reprogram computer systems and do all this enmeshing stuff, because this will be a separate and ideally as standalone as possible system for disabled children and their families. And this is to jump the gun, because we know that inevitably this is going to happen. So why don't we start doing this work now, so that when the Department for Education gets around to changing the system, when the courts get around to criticizing it, local authorities have already put in place those fine-grained local discussions with organizations and come up with locally produced procedures that it's in a way been able to do a dry run on. And so what we want to do is to encourage these discussions and help these discussions, and through things like this webinar. And then we're going to probably commission an organization, but we may do it ourselves, but we're looking to commission an organization to pull together all these views of parent carers organizations on what needs to be done. And of course, crucially, and this is something you can all suggest, we need to come up with a snappy, zappy title for this research. So we could call it bad form, good form, or to have form, or a matter of form, or form and substance, or off form, or it's form stupid, it's the form stupid. As you can see, I'm not very good at snappy titles. So it would be quite good to have something that encapsulated this element. And what we'd like to do in this research is to analyze what parent-carer-led groups think would be legitimate, appropriate questions to be asked or comments to be made, and what are unwarranted, inappropriate questions, i.e. those that focus attention on discovering failings and abuse, questions that support and questions that offend and why, missing questions, missing comments, missing questions that need to be asked but are not asked, or comments that need to be made that are not made. And one of the things that I've realized is I can never understand why a local authority can't do an independent parent-carer needs assessment. Why it has to be locked into a Section 17 assessment. Because the law says quite clearly you have a right to parent-carer needs assessment, freestanding. And I've only just really realized that it's nothing to do with what the law says. The problem is that most local authorities don't have a form that allows that. It has to always be, there's one form that's a combined Section 17 assessment. Forms that can only be completed if early help has been attempted and has failed. And also the length of form is something that we need to discuss. And I've again only realized this by looking at this aspect. I can never understand why local authority can't just do a straightforward assessment of a disabled children in needs assessment. Why it's got to sort of give it another name, like an early help assessment or something like that, or a mini assessment, or what matters assessment. And then I've seen the length of these forms, and I can see why social workers would be really reluctant to have to do one of these things in every case. And this is something that the White research comes up with. I mean, I live on the Welsh borders in Hereford, and I just Google their form for early help, for direct payments. So this is if you want early help, short breaks for up to 6 hours. So it's a very limited service. It's a time limited service, and it's only 6 hours, a maximum, I think, of 6 hours a week. It's freely on the web, so God bless them for doing that. But my God, that's the form that the social worker's got to fill out. And when you get to the very end of it, at the bottom it tells you that this is only for 6 hours social work, 6 hours short break a week. And if you want anything more than that, you've got to required to do a full children and families assessment. Well, if that's not a full assessment, you know, that's just sort of seems to be a preliminary foothill of an assessment. You can understand how the forms are completely distorting practice. And Monroe talks about that very strongly in her research about, you know, all the family want is something simple, but the family's got to complete, but the social worker's got to complete something like that, which would probably take a day, wouldn't it, at the minimum? So we want local groups to analyze, to the extent that they've got the time or the interest, the extent to which forms are being used for other purposes, to capture data that might be used to appease Ofsted, like we've interviewed every child on their own, or to complete the annual returns to DFE, over which there may not be much choice. I mean, these are sort of windmills that are too big to tilt at. But we just like to sort of work out what has to be in that form and what doesn't have to be in the form. And for these issues to be discussed between local groups and strategic leads of local authorities that effectively get it. And what has impressed Anna and I is the number of children's services senior officers who have been in contact via parent carer support groups that clearly are open to change, as are some senior members of the Department for Education. Quite clearly, there is an opportunity to bring about change. And then for that to be fed back to us, and then we can then sort of try and distill that and make suggestions for ways to create meaningful change. And we want to also get ideas about guidance, because it seems to me assessors need to know what families think. There are times when assessors have asked them that, why are we doing this assessment? And of course, the assessment has a purpose, but the strategic purpose for the local authority might be to gather data, whereas for the purpose for the family is simply, look, we would want, you know, 3 hours breaks on a Friday or something. So what assessors can do to make a positive impact, very much to be clear what neglect means, and that's come up quite a few times. Neglect doesn't necessarily mean an untidy house or a very tidy house. You know, we're talking about disabled children. The local authority has not been given any evidence of neglect or abuse. So there's no need to use some sort of stereotypical inspection methods that can convert normal range of activities into neglect. They need to understand why assessing disabled children and their families is qualitatively different to those of assessing children suspected of neglect and abuse, and why that is articulated in human rights terms. They need perhaps to be reminded about what the social model tells us about the nature of impairment. And so on. We're also, as part of this, interested in collecting standard forms. And I'm nearly finished on this talk. I mean, I haven't been able to find forms, and I've only done very limited research, that what we found is that 80% of local authority protocols say that the social worker must tell the senior manager that the bedroom was inspected, that the children were inspected alone, interviewed alone. But I can't find those forms, curiously. And that would be useful to have a look at those forms. But many local authorities do publish some or all of their assessment forms, not all of them, because, as I say, these key forms I can't actually find. But you can get sort of libraries if you go online. And I just did this with one local authority, and I'm not naming it. But, you know, God bless it again, it's got its documents library there. This is obviously an intranet for staff workers, but it's an extensive library of assessment forms and procedure forms and so on. And if you go through those documents, there's not one document relating to disabled children. They're all across the whole range of other areas, but working together guidance says that you should have procedures that address various issues. And when you go through those forms, and there's about 50 documents there, and they're not all forms, there's not one on disabled children, and I don't know what the population of disabled children is, but I think it's about 6 or 7% of the children's population. But there are 5 forms there on fabricated and induced illness, FII, which is something that's got a prevalence of 1 in 500,000 children, all children. So, you know, what is that telling us about local authority priorities? I can't see anything there about disabled children, but I can see 5 forms about an incredibly rare condition. So we're interested in forms and having the discussion about changing those forms. And I hope I've explained why I think they do form such a core part of activities. There are lots of other things that need to be changed. Some of them I think are in a way too big, but I'm very happy to be corrected on this. You know, the main problem with social service practice is this command and control managerialism, of which forms are a crucial torture, sort of instrument of torture. And even the most elementary request creates a bureaucratic nightmare for the individual and social services, I think, and sends families down a journey of into a hostile labyrinth, basically, with completely unintelligible apparatus of eligibility criteria, windscreens, dashboards, and all that paraphernalia, where everything is sacrificed on the altar of managerialism. And it's an incredibly expensive, unproductive regime, as business studies show on systems analysis. And it's destroying for both families and the social care workforce. So that's the rant I end on. But I hope I've given an overview of what we're thinking about. But our thinking is, as with all of the work the Cerebra does, utterly informed by what people at the coalface, people, families and carers are experiencing.